This is the part 2 video on growth and development. So let's start. Child development takes place from birth to adolescence, and most of the questions are asked from this part only for the exam. Child starts its growth from womb, that is prenatal stage, which is for 40 weeks. Here there are two principles which every child goes through. One cephalocaudal, two proximodistal. One cephalocaudal. In cephalocaudal, development is from head to toe. 2. Proximodistal. In proximodistal, development is from heart to periphery, that is, from the center of the body to outward. Now, let's have a look at infancy. Infancy is from 0 to 2 years. In infancy, child will try to walk. Next is childhood. Childhood is from 2 to 11 years. Over here, child will make a gang in this stage. In this stage, there are two stages, that is, early childhood and later childhood. Early childhood is from 2 to 6 years, and later childhood is from 7 to 11 years. Early childhood. Here, child learns a language at fast speed. This stage is very crucial for language development, and this stage is also called as pre-gang age or play age or preschool age. Later childhood stage. This stage is also called as gang age or school age or troublesome age. Here, child makes long-lasting friendship. Childhood period acts as a base. Factors influencing growth and development. Internal factor and external factor. Let's have a look at the internal factor. Internal factor is from within. It is said that mothers should not drink, smoke while the child is in her womb. Next is external factor. External factor is after birth environment, giving proper nutrition and taking care of the child. If proper nutrition is not provided to the child, then it may affect the child. Next stage is adolescence. This stage is also called as transitional period. Child tries to form his own identity, and there is physical hormonal change that takes place in the child. Stanley Hall has written one book called Adolescence. In this book, he has written one line: adolescence is the age of stress and storms. This type of questions have appeared in the most of the TET exams. So now let's have a look at some of the important questions and answers. Question 1. There are individual variations in the rate of motor development, yet the sequence of motor development is from dash to dash. A. Proximodistal cephalocaudal. B. Gross motor development, fine motor development. C. Fine motor development, gross motor development. D. Cephalocaudal, proximodistal. Motor development refers to physical development, and motor skill is simply an action that involves using muscles. Gross motor skills are large movements that a child makes with his or her arms, legs, feet, or entire body. So, crawling, running, and jumping is gross motor skills. By 6 to 12 months of age, infants may be able to crawl, stand, or walk. In fine motor skills are smaller actions. When a baby or child picks the things up between his fingers, he is using fine motor skills. He even uses his lips and tongue to taste and feel objects, and fingers and toe muscles are the last to develop in physical or motor development. So, what is cephalocaudal? Cephalocaudal sequence refers to head to toe sequence. Proximodistal. Proximodistal sequence means that development proceeds from the center of the body towards the outer part of the body. So, the correct answer over here is option B. Gross motor development, fine motor development. Question 2. The development from the central part of the body towards peripheries or extremities denotes the dash. A. Principles of decentralized development. B. Principles of proximodistal development. C. Principles of cascade development. D. Principles of radiated development. Motor development in the human body does not occur haphazardly. It follows a definite sequence which may differ from individual to individual due to the degree and timing of development. Proximodistal progression. In this progression, growth starts at the center of the body and moves towards the peripheries or extremities. It describes the direction of growth and development occurring from the center to the outward in an infant. For example, infants gain control first over their arms and then their hands and fingers. Cephalocaudal. We all know that cephalocaudal is from head to toe. Hence, it becomes clear that the development from the central part of the body towards peripheries or extremities denotes the principle of proximodistal development. So, the correct answer over here is option B, principles of proximodistal development. Question 3. Between dash months of age, most children begin to combine words into short sentences while speaking. A. 18 and 24. B. 24 and 30. C. 30 and 36. D. 12 and 18. Language development is a process that starts early in life by which children begin to understand and express feelings through languages. Between 18 and 24 months of age, most children begin to combine words into short sentences while speaking. At this age, they use around 50 words and start placing two words together in short sentences. When child is 6 to 8 months old, he babbles. That means he does ba ba ba. In 9 to 18 months, he tries to utter word, and when the child becomes 18 to 24 months old, he makes an attempt to utter two words. When the child becomes 24 to 30 months, he tries to speak multiple words. After 30 months, child tries to make longer sentences. Hence, it becomes clear that between 18 and 24 months of age, most children begin to combine words into short sentences while speaking. So, the correct answer over here is option A, 18 and 24. Question 4. Which of the following is a sensitive period pertaining to language development? A. Adulthood. B. Early childhood period. C. Prenatal period. D. Middle childhood period. Now let's see the information about the different stages. First, adulthood. that is from 12 to 18 years. In this stage, child becomes physically strong and emotionally vulnerable. Second, early childhood period. This period occurs from 3 to 5 years. Over here, child can walk, uses toilet, then interacts with his family members. When it comes to intellectual development, he can recognize color, shape, size of objects. Also, his imagination develops. He wants to know about things around him. Option C, prenatal period. This is before birth. This stage occurs during the period of 38 weeks prior to the child. During this period, a single cell becomes a full term baby. This period is generally divided into three categories: the germinal stage, the embryonic stage, and the fetal stage. Option D, middle childhood, also known as later childhood. This stage occurs between 6 to 12 years. Over here, slow growth rate happens. Also, improves motor skills, better thinking ability, social with friends, neighbors, along with parents. So, the correct answer over here is option B, early childhood period. Question 5th. Early childhood refers to the period from A 2 to 8 years, B 6 to 12 years, C birth to 5 years, D birth to 8 years. Infancy is from 0 to 2 years. Then early childhood is from 2 to 6 years. Then later childhood is from 7 to 11 years. Then adolescence. Adolescence is from 12 to 18 years. As per WHO, adolescence age is 10 to 19 years. So the correct answer over here is 2 to 8 years.